If you have been prescribed levothyroxine, also known by the brand name Synthroid, you are definitely not alone. In fact, it's one of the most commonly prescribed medications in the world. Doctors use it to treat hypothyroidism, which simply means your thyroid is not making enough hormone on its own. Levothyroxine is basically a synthetic version of thyroxine, or T4, which is the hormone your thyroid would normally produce. For many people, this little pill feels like a lifesaver because it helps boost energy, stabilizes metabolism, and supports overall health. But here's the truth. While levothyroxine is effective, it also comes with a list of side effects that many people are not fully aware of. Some of these side effects are mild, others can be quite serious, and if you do not recognize them, you may end up blaming yourself, your lifestyle, or even unrelated health issues. That's why in this video, I am going to break down the side effects of levothyroxine that you absolutely must know. By the end, you will understand what to look out for, how to recognize if your dosage may need adjusting, and why it's so important to stay proactive when it comes to your thyroid health. Welcome back to the channel. And if it's your first time here, don't forget to hit that like button and subscribe to the channel. Number 1. Heart palpitations and rapid heartbeat. One of the first things many people notice after starting or adjusting their levothyroxine dose is a racing heart. You may feel like your heart is pounding in your chest, skipping beats or beating faster than usual, even when you are just sitting still. Why does this happen? Well, levothyroxine is a synthetic form of T4, which your body converts into T3, the active thyroid hormone. When levels are too high, your heart gets overstimulated. Think of it like pressing down on the gas pedal too hard. Things speed up more than they should. And over time, this can increase the risk of arrhythmias, or irregular heart rhythms. The tricky part is that palpitations can be easy to brush off. People often think, oh, maybe I had too much coffee, or I'm just stressed. But if you are on levothyroxine and this keeps happening, it could very well be a signal that your dosage is too high and your cardiovascular system is paying the price. That's why it's so important to monitor your dose and get your thyroid levels checked regularly. Bottom line, if you ever feel your heart racing or fluttering, do not brush it off. Get it checked. Number 2. Anxiety and nervousness. This is one of the most surprising effects of levothyroxine. Some patients say they feel jittery, restless, or like they cannot sit still. Others even experience full-blown panic attacks. And when you think about it, this actually makes sense. Thyroid hormones don't just boost your metabolism, they also stimulate your nervous system. Imagine drinking 5 cups of coffee without realizing it. That's the kind of effect it can have. Unfortunately, many people are misdiagnosed with an anxiety disorder when, really, it's their medication dose that needs adjusting. So if you have been feeling unusually nervous or restless since starting levothyroxine, it may not be just you. Simple lifestyle changes, such as incorporating magnesium-rich foods, practicing calming breathing exercises, or taking a few minutes to slow down with meditation, can certainly help. However, in many cases, the real solution comes from working with your doctor to fine-tune your dosage and bring everything back into balance. Number 3. Insomnia. Now, insomnia is one of the most frustrating side effects of levothyroxine. Some people cannot fall asleep, while others wake up in the middle of the night, wide awake, unable to drift back to sleep. Again, it all comes down to overstimulation. As already mentioned, thyroid hormones rev up your metabolism, which is great for energy during the day, but terrible when you are trying to wind down at night. One simple tip here: make sure you are taking your levothyroxine in the morning on an empty stomach with water only. Taking it late in the day can throw off your body's natural rhythms and make sleep nearly impossible. Pair that with good sleep hygiene, such as dimming lights, avoiding screens before bed, and keeping your room cool, and you will notice a significant difference. Number 4. Weight changes. This one often confuses many people. If levothyroxine is meant to balance metabolism, why do some people still gain weight while others lose it too quickly? Well, the key here is dosage. Your thyroid medication only works properly when the amount you are taking matches your body's exact needs. If you are getting too much, your metabolism speeds up, and you may lose weight rapidly. If you are not getting enough, things slow down, and weight gain can happen. That's why so many patients feel frustrated. They think the medication is not working, when in reality it often just needs a small dose adjustment. So, how does your doctor figure that out? Well, most of the time, they start by checking your TSH, or thyroid stimulating hormone. Think of TSH as your brain's thermostat. It signals how much thyroid hormone your body should be making. But here's the catch. TSH alone does not always tell the whole story. That's why it's also important to look at your T3 and T4 levels. These are the actual thyroid hormones that drive energy and metabolism in your body. Levothyroxine itself is a replacement for T4, which then converts into T3, the active form your cells use. By looking at all three, TSH, free T3, and free T4, your doctor can get a much clearer picture of whether your thyroid levels are truly balanced. Number 5. Hair loss. When you first start taking levothyroxine, it's pretty common to notice a little more hair in the shower drain or some thinning around your hairline. Understandably, that can feel alarming. But here's the good news. For most people, it's only temporary. Thyroid hormones play a big role in your hair growth cycle, and when your medication dose changes, your hair follicles need time to adjust. Think of it as your hair pressing the reset button. Once your hormone levels even out, the shedding usually slows down and healthy regrowth can begin. Number 6. Sweating and heat intolerance. Have you ever felt like you are the only one in the room sweating while everyone else seems comfortable? Well, that's another classic levothyroxine side effect. Because this medication boosts metabolism, your body generates more internal heat. That means you sweat more, and your tolerance for warm environments goes way down. Some people even struggle to sleep because they overheat at night. While this is not dangerous in itself, it can be incredibly uncomfortable. Number 7. Mood swings and irritability. Thyroid hormones do not just control your metabolism, but they also affect your brain chemistry. That's why mood swings are so common in people taking levothyroxine. You might feel unusually irritable, quick to anger, or even depressed, only to swing back into a more upbeat mood later. Some patients report that they no longer feel like themselves, and that can be really tough, not just for you, but for the people around you as well. Now, the important thing to understand is that this isn't a personality flaw. It's your body responding to an imbalance caused by either too much or too little thyroid hormone. Number 8. Muscle weakness or tremors. Another surprising effect is muscle weakness and tremors. You see, thyroid hormones play a huge role in muscle strength and nerve activity. When there's too much levothyroxine in your system, your muscles can actually break down faster than they are rebuilt, which leads to weakness. At the same time, your nerves can get overstimulated, and that's what causes those shaky hands or fine tremors. Now, this can sometimes look like anxiety, but in reality, it's your body's physiology at work. So if you have noticed it feels harder to climb stairs, lift things, or even carry lighter objects than before, it could be connected to your medication. Number 9. Gastrointestinal issues. A lot of people do not realize that levothyroxine can affect digestion. Some of the most common side effects are things like bloating, diarrhea, or stomach cramps. And here's why. Thyroid hormones naturally speed up gut motility, which simply means food moves through your digestive system more quickly than normal. But that's not the only factor. Absorption can also be tricky. Everyday things like coffee, calcium supplements, or iron can block levothyroxine from being absorbed properly. And when that happens, you may end up under-medicated even if you are taking your pills exactly as prescribed. That's why timing matters so much. The best way to take levothyroxine is first thing in the morning, with just water, and then wait about 30 to 60 minutes before eating anything else. Number 10. Bone loss. Over-medication with levothyroxine can speed up bone loss, which makes your bones weaker over time. This increases the risk of osteoporosis and fractures, especially in postmenopausal women and older adults. Now, the good news is that this risk is very manageable. With the right dose, regular check-ins with your doctor, and healthy habits like weight-bearing exercise, getting enough vitamin D, and making sure you are meeting your calcium needs, you can protect your bones. So if you are on long-term thyroid medication, this is definitely something to keep in mind. Staying aware and proactive makes a big difference. And there you have it. Remember, knowledge is power, and you have the power to make informed choices for your health. Thank you for watching.